The cardiac monitor screamed a warning. Just as Lieutenant Colonel Graves hurled the bedpan across the room, and the new orderly, who had made the mistake of touching his arm without asking permission, was already halfway out the door, shoulders shaking. Sadie Kowalski did not look up from the medication chart she was reviewing at the nurse's station. She heard the clatter of aluminum against linoleum. She heard the orderly's strangled apology. She heard Graves's voice, a voice like gravel being dragged across concrete, ordering someone to get him a real doctor, a military doctor, not another soft civilian who looked like they learned medicine from a podcast. She had been hearing variations of that voice for 19 years. Different rooms, different wars, same damage underneath. He's going to arrest if he doesn't let someone check that suture line, Dr. Okonkwo said quietly, appearing beside her, with the resigned expression of a man who had already used up his patience before 9 in the morning. He pressed Graves's chart into her hands. The cardiology resident walked out, said she didn't sign up to be berated. I don't disagree with her. Sadie took the chart without a word. The Beaumont Veterans Affairs Medical Center sat on the flat outskirts of Beaumont, Texas, where the sky went on forever and the heat never fully let go, even in November. Ward 6B was the cardiac and vascular unit, and, on this particular Wednesday morning, it smelled like burned coffee and industrial floor wax and the particular kind of tension that settles into a hallway when one patient has already made 4 nurses cry before breakfast. Sadie had worked 6B for 6 years. Before that, she had worked the trauma bay downstairs. Before that, she had done things that did not appear on her nursing resume and that she did not discuss at staff meetings. She was 37 years old, compact and precise in her movements. With dark hair she wore in a knot so tight it pulled slightly at her temples. Her colleagues described her as calm to the point of being unsettling. Patients who tried to manipulate her with anger or tears tended to find that neither instrument produced any particular effect. She was not cold. She simply had a very accurate sense of what mattered and what did not. Calibrated by experiences she kept locked in a room inside herself that she rarely opened. She read Graves's chart standing at the counter. Lieutenant Colonel Harlan, she caught herself, Lieutenant Colonel James Graves, retired, 64 years old. Admitted 3 days ago following a myocardial infarction, the second in 18 months. Post-surgical suture line at the chest showing signs of early infection. Elevated white cell count, history of prior combat injuries, multiple shrapnel fragments still embedded in the left shoulder and upper back, removed partially in 2008, remainder deemed non-operable. 3 tours, 2 in Iraq, 1 in Afghanistan. Her eyes stopped moving on the page. She read the line again. 2nd Battalion, 75th Ranger Regiment, Operation Anaconda, Afghanistan, 2002. Operation Iraqi Freedom, 2003. Mosul, 2005. Her jaw tightened, just barely. Just enough that if someone had been watching very closely, they might have noticed. She closed the chart with a clean, quiet snap. Draw up the cefazolin, she told the charge nurse, and a fresh dressing kit. She prepared the tray herself. She did not rush. She laid out each item in precise order, the way she had been taught to lay out supplies in conditions where rushing got people killed. When everything was arranged to her satisfaction, she picked up the tray and walked down the hall toward room 614. Through the narrow window in the door, she could see him. James Graves was a large man made smaller by illness, though not by much. He sat upright against the raised head of the hospital bed, with his arms crossed over his chest, which was bandaged from the sternotomy. His silver hair was cut close, almost regulation short. His face carried the particular geography of a man who had spent decades squinting into harsh light, deep lines at the corners of his eyes, a jaw that looked like it had been set permanently against something. The television was on. He was not watching it. He was watching the door. Sadie pushed it open and walked in. I told the last one to send me someone who actually knows what they're doing, Graves said immediately. His voice was controlled, but it had an edge that could strip paint. Not another nursing student. "Good morning, Colonel Graves," Sadie said, setting the tray on the bedside table. "My name is Kowalski. I'll be managing your care today." Kowalski. He repeated it like he was deciding whether to approve of it. "You look like you're 12. I'm 37. She pulled on her gloves. "I need to check your suture line and change the dressing. Give me your left hand so I can check your pulse first." I didn't give anyone permission to touch me. "I know." She held out her hand, palm up, and waited. He stared at her. She did not flinch, did not soften, did not add anything to fill the silence. She simply held her hand out and waited. The way you wait for something you have no doubt will eventually happen. Graves made a low sound of contempt and thrust his left hand toward her. She checked his radial pulse, noted it on the chart, checked his capillary refill, examined the skin temperature of his fingers. All of it methodical, practiced, unhurried. "Your distal circulation is adequate," she said. "Your suture line is what concerns me. I'm going to need you to lower the gown at the shoulder. You're not touching that chest wound. The infection markers in your blood work suggest early cellulitis along the incision," Sadie said, beginning to open the dressing kit. "If it progresses to the sternum, we are looking at mediastinitis. That is a complication with a mortality rate between 14 and 40%, even with aggressive treatment. So yes, I am going to touch it." Graves's eyes narrowed. "You memorize statistics to intimidate patients?" "I memorize statistics because they're useful." She pulled back the surgical tape on the edge of his dressing, peeling it carefully from the skin. "This is going to pull. Tell me if it's too fast." "I've had shrapnel pulled out of my back without anesthesia," he said flatly. "I think I can manage a Band-Aid." "That's not what I asked you." A beat of silence. Something shifted almost imperceptibly in his expression. Not softening exactly, more like a recalibration. "It's fine," he said. She worked efficiently, removing the old dressing, examining the suture line with a penlight. The incision was clean at the center, but angry at the lateral edges, red and slightly swollen in a way that had not been there yesterday, according to the notes. She photographed it with the unit camera, documented the measurements. "You had shrapnel removed in 2008, she said, not looking up from her work. Her voice was even, purely clinical. "Left shoulder, upper back. The report says there were fragments from an IED, Mosul." Graves went very still. "That's in my file," he said carefully. "Yes." She began applying the new antibiotic-coated dressing. "What street?" The silence lasted 3 full seconds. "What did you say?" "What street in Mosul?" She pressed the dressing gently into place, the IED. When she looked up, James Graves was staring at her, with an expression she had not seen on his face yet. Not anger, something more complicated. "Why are you asking me that?" "I'm almost done with the dressing," Sadie said. "Hold still." She finished securing the tape and stripped her gloves, disposing of them in the biohazard bin. She began gathering the used materials from the tray. Graves had not taken his eyes off her. "How do you know about Mosul?" he said. It was not a question anymore. Sadie said nothing. She picked up the tray. "Who are you?" His voice had changed. The contempt was gone. What replaced it was something rawer. "I told you, Kowalski. Ward 6B." She moved toward the door. "Kowalski." He said it differently this time, like he was turning it over, looking for something on the underside. "Wait." She paused at the door. "I knew a Kowalski," Graves said slowly. "In Mosul, combat medic, attached to Bravo Company during the Haifa Street operation. 2005. His voice had gone flat and careful, the way voices go when a person is trying to hold something very fragile without dropping it. She was 20, 22 maybe. Never saw her face, just the back of her vest. She was already working on Sergeant Pruitt when we pulled up. Never stopped moving. He stopped. His jaw worked. She got him out, them. 3 of them, under fire. Another pause. We never found out what happened to her after. The morning light through the hospital blinds fell in long pale strips across the floor between them. Sadie set the tray back down on the bedside table. She turned to face him fully. She reached up and pulled back the left sleeve of her scrubs, past her elbow, all the way to the upper arm. The tattoo was not decorative. It was the kind of ink that gets put on skin for the purpose of remembering, not for the purpose of display. The design was compact and precise. A caduceus, the winged medical staff, overlaid with crossed rifles and the distinctive ranger scroll arching above it, the kind that only soldiers who have earned the right to wear it would recognize on sight. Below the scroll in plain block lettering, the words that made James Graves stop breathing. 75th Ranger Regiment, Bravo Company, Operation Iraqi Freedom. "I got 3 of your guys out," Sadie said. Her voice was still level, but it had lost the clinical detachment entirely. What was underneath it was something older and quieter. Pruitt, Kellerman, and the kid from Arkansas, Dawson. Pruitt lost the leg below the knee. Kellerman had a collapsed lung and a broken orbital. Dawson was the one I almost lost on the street before the medevac came. Graves had not moved. He looked like a man who had just been told something that reorganized the entire structure of a building he had been living in for 20 years. "Dawson," he repeated. The word came out like air escaping from something that had been sealed a very long time. "I thought Dawson." "He made it." Sadie pulled her sleeve back down. "I looked him up years later. He's in Fayetteville, has 2 kids. Graves turned his head away. He looked at the window. Outside was a parking lot and a flat Texas sky and the ordinary, unremarkable world, none of which he appeared to be seeing. "I wrote his mother a letter," Graves said. His voice was very quiet now. I wrote her a letter that said we did everything we could." A pause. "I believed he was dead. We all did. The medic. You were already gone when we pulled the rest of the team back. The building came down on the east side and we couldn't." He stopped. His hand came up and pressed against the dressing on his chest. "Not in pain, or not only in pain. I have been carrying that boy's death for 19 years. Sadie pulled the rolling stool from the corner and sat down beside his bed. She did not tell him it was all right. She did not offer the reflexive comfort that the situation seemed to call for. She had learned, a long time ago, that some moments are not helped by comfort. They are helped only by the truth, delivered plainly, by someone who was actually there. Haifa Street was a mess from the beginning, she said. The intelligence on the building layout was wrong. Nobody knew there was a secondary cell on the upper floor until they were already on top of us. By the time the first charge went off, I had Pruitt down and Kellerman wasn't breathing right. And Dawson was conscious, but he had shrapnel in his side and he kept trying to get up. She paused. He kept saying he needed to go back for you. He thought you were still in the building. Graves turned back to look at her. I had to hold him down, Sadie said. I told him you ordered me to get him out. I said it about 6 times before he stopped fighting me. She met his eyes steadily. It wasn't true. I had no idea where you were, but it was the only thing that worked. Something moved through James Graves's face, a slow unwinding, like a fist opening after years of being clenched. His eyes were bright and hard, and he was clearly fighting to keep them that way, and losing. You lied to my soldier, he said. I improvised, Sadie said. There's a difference. A sound came out of him that was not quite a laugh, and not quite something else. It lasted only a second before he pressed it back down. Where did you go? He said after. The building came down on the alley side. We had to move north, away from your extraction point. By the time we got to the medevac staging area, it was a different unit running the show. I filed my report. They filed theirs. The paperwork went in different directions. She shrugged slightly. That's how it works sometimes. You know that. I know that, he agreed quietly. They sat in silence for a moment. Outside in the hallway, the ordinary sounds of the hospital continued. Footsteps, a cart rolling, someone's pager, a phone ringing twice and stopping. You've been a nurse here how long? Graves said. 6 years on this ward, 3 in trauma downstairs before that. And before that, Army combat medic, 8 years active. She glanced at him. Then I couldn't do the Army anymore, and I wasn't ready to stop doing this. She gestured vaguely at the room, the equipment, the work. So, Graves nodded slowly. He was quiet for a long moment, looking at her in a way that had none of the earlier hostility in it. Just something searching and unguarded that sat oddly on a face built for command. I owe you an apology, he said, for this morning. He stopped. I don't do well in hospitals. Never have. I lose my grip on things in hospitals. I know that's not an excuse. It's not an excuse, Sadie agreed. But I've seen worse. She stood and picked up the tray again. Your cefazolin is running low. I'm going to start a new bag. You need to eat something before 11 or your electrolytes are going to be the next problem I'm dealing with. Kowalski. She paused. Dawson. Graves said the name carefully, like he was confirming something he still didn't quite trust. You're sure? I'm sure, she said. He exhaled slowly. His eyes closed for a moment, and when they opened again, something in his bearing had shifted. Not collapsed, not weakened, but settled, like a structure that has been braced against an impact that never came and has finally been allowed to stand at ease. All right, he said, I'll eat. Over the next 4 days, Ward 6B experienced a transformation that the nursing staff discussed in low voices at the medication station, and that Dr. Okonkwo would later describe in his characteristic understatement as a significant behavioral improvement. The man who had reduced 3 nurses and 1 cardiology resident to tears in his first 48 hours became, if not warm, then at minimum cooperative. He followed care directives. He did not throw things. When the physical therapist came to begin his ambulation protocol, he did the full 3 laps of the hallway without argument, though he made the therapist keep pace with him rather than the other way around. He asked for Sadie specifically every shift, not because he couldn't manage with the other nurses, but because it was clear that she was the only one he fully trusted, and in a man like Graves, trust was not transferred easily or partially. It was given whole or not at all. On the third morning of his improvement, Sadie came in to find him sitting up in bed with a piece of paper in his hand, writing something in a cramped, disciplined hand. "What's that?" she said, checking his IV line. "A letter," he said without looking up. She did not ask to whom. She charted his vitals, adjusted the drip rate, checked the suture line. Healing cleanly now, the redness receding. She was about to leave when he held the paper out toward her. She took it. It was addressed to a Mrs. Patricia Dawson, 114 Brentwood Circle, Fayetteville, North Carolina. "Dear Mrs. Dawson," it began. "My name is James Graves. I was your son's commanding officer in Mosul in 2005. For 19 years, I believed I owed you an apology that I was not able to put into words. I have recently learned that I was wrong about the facts, though not about my responsibility for your son's welfare. I am writing now because I believe you should know that the person who brought him home to you that day was a 22-year-old Army combat medic from Ohio named Kowalski, and she deserves to be part of the story you tell about your son's life." Sadie stopped reading. She looked up. Graves was watching her. "You don't have to send that," she said. "I know I don't have to." He held out his hand for the letter. "That's not why I'm sending it." She gave it back. She did not say anything else about it. She gathered her supplies and moved toward the door, and then she stopped, her hand on the frame, not quite turning around. "His name," she said, "Dawson. His first name was Tyler." "I know," Graves said quietly. "I know all of their names." She nodded once and walked out into the hallway, where the ordinary morning of the ward was continuing around her. Someone laughing at the nurse's station, a breakfast cart rattling past, the clean, persistent smell of antiseptic and burned coffee. And she stood still in the middle of it for a moment with her eyes closed, breathing the familiar air of a place she had chosen. Deliberately, and with full knowledge of the cost, to make her battlefield. On discharge day, a Friday, the November sky over Beaumont was the color of old tin, flat and enormous and indifferent, the way Texas skies sometimes are when they're not showing off. Sadie had just finished her morning rounds when the charge nurse flagged her down near the elevator bank. "There's something at the front entrance for you," the charge nurse said. Her expression was difficult to read. Sadie walked down to the main lobby. James Graves was in the discharge wheelchair, dressed in civilian clothes, dark pants, a plain gray shirt, a jacket with a Ranger tab pin on the lapel. He was not alone. Standing around him, in the loose but unmistakable formation of people who have spent years moving together, were 7 men and 2 women. They ranged in age from late 30s to early 60s. Some were in civilian clothes. Some wore leather cuts or ball caps with unit insignia. One had a prosthetic left arm. One walked with 2 canes and stood with the careful deliberateness of someone managing significant pain who refuses to be managed by it. One woman, close to Sadie's age, wore an EMT jacket over her civvies and had the particular posture of someone who has run toward bad things for a living. Sadie recognized none of their faces. She recognized all of them anyway. Graves pushed himself to standing from the wheelchair when he saw her cross the lobby. He moved carefully, but he stood fully upright, the way a man stands when he is making a point about something. "I made some phone calls," he said. The lobby had grown quieter. Patients in chairs, family members waiting near the desk, a maintenance worker with a cart, all of them slowing, sensing something. Pruitt, Graves said, and the man with the prosthetic arm raised his chin. Kellerman, the woman in the EMT jacket. These are people you carried out of bad places, Graves said simply. A few of them couldn't be here. Most of the ones who could came. Sadie looked at the group, at Pruitt, who had been 18 years old in a street in Mosul with a tourniqueted leg screaming for his mother. At Kellerman, who had been clinically apneic when Sadie reached her and had a pulse again 4 minutes later. At the others, some of whom she had worked on and some of whom she hadn't, but all of whom carried the same particular gravity. The weight of people who had looked at the absolute worst of things and were still standing in a hospital lobby in Texas on a gray Friday morning. Graves reached into the inside pocket of his jacket and removed a small object. He held it out to her. It was a challenge coin, old, worn smooth in places, the kind that lives in a pocket for many years and acquires its own particular weight from handling. On one face was the Ranger scroll. On the other face, engraved in letters that had been worn soft by time, were the words Haifa Street, January 2005. Those who came home. This was Dawson's, Graves said. He mailed it to me last week. When I called to tell him about you, he said to give it to the person who kept him alive long enough to have a reason to carry it. Sadie took the coin. It was heavier than it looked. She stood in the middle of the lobby with the coin in her palm, and the group of veterans arranged around their commander, and the ordinary business of the hospital continuing behind her, and she did not cry. She had spent a long time learning how to hold things without putting them down, which is not the same as never feeling them. She closed her fingers around the coin. "Tell Dawson," she said, "that I still expect him to stay out of buildings that are actively on fire." Pruitt made a short sound that might have been a laugh. Kellerman pressed her lips together hard. Someone at the back of the group exhaled. Graves looked at her for a moment. Then he said, "Detail." And the veterans of Bravo Company, 2nd Battalion, 75th Ranger Regiment, straightened where they stood and raised their right hands in a salute that had nothing to do with rank and everything to do with what one human being owes another when they have seen the worst of what the world contains and been carried through it anyway. Sadie Kowalski stood straight and returned it. The coin was still warm in her hand when they walked out the glass doors into the flat gray Texas morning, and she stood watching them go until the lobby began to move again around her, and then she turned back toward the elevator and Ward 6B. And the next patient, and the next shift, and the long ordinary work of keeping people alive, which was the only thing she had ever known how to do with her whole self, and the only thing she had ever needed. I keep thinking about the moment Sadie didn't say anything. Graves had just told her to get out, not politely. The way someone orders a subordinate out of a room when they've already decided the conversation is over. And she stood there holding her tray and she just waited. No argument, no flinch, no performance of patience. She waited the way a person waits when they already know something the other person doesn't. And they've decided the right time to say it hasn't arrived yet. That's the part I can't stop turning over, because it would have been so easy, and honestly so human, to defend herself, to say something, to prove something. Graves was wrong about her in every specific way a person can be wrong about another person. And she knew it, and she let him be wrong a little longer because she understood that winning the argument wasn't the point. Getting him well was. That kind of clarity doesn't come from nowhere. It comes from having been tested so many times in conditions so much worse than a difficult patient in a hospital room that you stop needing external permission to trust your own judgment. Sadie had crawled through suppressive fire on a street in Mosul to reach men who were dying. She had made decisions in seconds that she had to live with for years. By the time she was standing in room 614 of a VA ward in Beaumont, Texas, some 22-year-old version of fear had long since been replaced by something quieter and more durable, the kind of steadiness that doesn't require an audience. What moves me about this story, every time I sit with it, is the way the truth did its work without being forced. Sadie didn't reveal her history to win. She revealed it because Graves had reached a point where the truth was the only thing that would actually help him. Not as a correction, but as a release. 19 years of carrying the belief that he had sent his men into a trap. 19 years of Miller's mother's face in his sleep. And the person who could finally put that weight down wasn't a therapist or a chaplain or a general with a classified file. It was a nurse in blue scrubs who had been in that alley and had carried the other half of the story the whole time. That's what I think about when I think about what it means to actually do right by someone. Not the dramatic gesture, not the confrontation. The years of quiet competence that make you the person who can help when the moment finally arrives. Sadie didn't become who she was in room 614. She became who she was in Mosul, and in every hard shift before and after, and in every decision to keep showing up for work that nobody applauded and everybody needed. And Graves, I think about him too. The cost of being wrong with that much certainty for that many years. Anger is exhausting to maintain. It takes real energy to hold people in contempt, to keep your walls high, to refuse help from people who are genuinely trying to give it. He paid that cost, and the people around him paid it too, and none of it changed the facts on the ground. What finally changed things wasn't his strength. It was his willingness, in one unguarded moment, to hear something that rearranged everything he thought he knew. There's a version of strength that keeps you safe and keeps you stuck at the same time. And there's another kind, harder to build, easier to miss. That's really just the courage to stay open. To let what's true be true, even when it costs you the story you've been telling yourself. Sadie had it. Eventually, Graves found it too. I think that's the whole of it, right there.